fix. So whether it's the back or whether it's the feet, surgery is always the last thing you want to ever try. Do the simpler things first. If that doesn't work, then you go see the surgeon. What spinal decompression is, if you've ever been familiar with the old-time traction units, and, maybe grandma or grandpa or yourself have had a traction unit, you may lay in bed and they put you in this harness around your waist, and they have these weighted bags or these weights that actually traction your back. Or even 20 years ago at the hospital, a lot of patients that would have lower back pain, the first thing they do was they put them in a traction unit. And usually these traction units are static. They have some kind of a weight. They put them in a harness, similar to what decompression is. And basically they put a weight on the lower part of the back, and it just basically tractions or stretches out the vertebra in the lower part of the back, taking pressure off the disc. And the purpose of doing that was hoping that by doing that, that would alleviate some of the patient's disc pain, maybe reduce some of the disc bulge protrusion or herniation, and maybe even reduce some of the muscle spasm. Problem was, every patient that I'd seen that had been to the hospital with static lumbar traction, it seemed like it got worse, not better. At least 9 out of 10 of them did anyway. And it was a static traction. It's traction of the joints, and then once you take the weight off, it goes right back to its old position again.
Like on the movies when someone broke their legs or arms or whatever, they would be like...
Yeah, it's just a hinge pulley kind of
right.
system, with their lower part of their back. Well, after that, there was a traction system called intermittent motorized traction. They actually used a motor where they actually not only did the tractioning effect between the bones and the disc, but actually the motor actually would stretch it and relax it, stretch it and relax it. So in a sense, it did a decompression type procedure. Problem was, for a lot of patients, if they were in spasm, when you actually perform the traction part of the process, the muscles go into a protective muscle spasm or a splint, so you really wouldn't get a full stretch or opening of the disc space. The other part of intermittent segmental traction was when the tractional force was released, it loaded the disc again, so it can be very painful, but also I think it can actually cause some harm to the disc. Well, as years have gone by and as traction has evolved over time, finally something called spinal decompression evolved, which is a more sophisticated form of intermittent motorized traction, like we saw 20 years ago. The only difference is we're able to actually preload, unload the disc, and when we turn the machine off, we're able to gradually reduce the disc pressure or disc load. So it's much more comfortable with the patient. We can actually do it in such a way that we're not dealing with muscle spasms, so it's very comfortable for the patient. But what we're able to do with that, because of the various angles of pull, depending on the disc level, we're able to actually cause a decompression type effect within the disc. The reason that's good and that helps is, if you think about the disc itself, have we ever talked about discs?
Yeah.
Oh, real quick. You can think of a disc as the cushion or shock absorber in between the bones. Let's go get a model real fast. It's hard to visualize this in your head, I think.
I'm here with you when you do.
Freezing. That window. Yeah.